some of you might know, if you look at RSBI, if you look at the service coverage of RSBI, for a family of 5, the maximum coverage per annum was about 30,000. But if you look at the state government funded health insurance schemes, Andhra, for instance, the Arogyasri scheme gave a coverage of about 1.5, 2 lakhs. Tamil Nadu gave a coverage of about 1.5, close to about 1.5 lakh. So if you look at some of the southern states, the state government funded health insurance schemes, the service coverage was not only high, but even in terms of the population coverage. For instance, Andhra, if you look at, 85% of the population were covered, unlike RSBI, which essentially targeted the poor. And the Ayushman Bharat is attempting to cover not just the poor, near poor. So that's about 40% of your population. But Andhra, already covering about 85%. Tamil Nadu covers about 55% of the population, right? Both in terms of population coverage as well as in terms of service coverage, the southern states are already doing much better than what the RSBI actually ended up doing. But if you look at the Ayushman Bharat, yes, no doubt, it wants to cover about 40% of your population. That's about 500 million people. So in a sense, they are going to expand the population coverage. In terms of service coverage is something that really very significant announcement, in the sense that RSBI gave a coverage of only about 30,000 per family on a floater basis per annum. Now that's going to go up to 5 lakhs. That's a lot of money per family on a floater basis. But if you look at the cost, you might know that the entire, whether it is essentially RSBI or the state-funded government health insurance schemes, essentially their coverage is only about hospitalization. What's the primary aim of these schemes? One is to improve health, improve access to health care, and provide financial risk protection. And what does it really mean, providing financial risk protection? Is to reduce households' out-of-pocket payment. If you rank countries around the world, there are about 190 countries around the world. India would be about 185th in terms of public spending. So essentially, people, you and I, are paying a lot of money from our own pockets. That's considered to be inefficient and iniquitous. Therefore, one of the major principles of this whole idea about government-funded health insurance scheme is to bring the households' out-of-pocket payment down. But if you look at households' out-of-pocket payment, a large share, about 2/3, is on account of outpatient care, not because of inpatient. Therefore, any such schemes which is going to target only hospitalization, you're not going to reduce our households' out-of-pocket payment. Our evaluations, both at the micro level as well as at the macro level, we looked at a lot of data. We didn't find any improvement in terms of financial risk protection, despite 10 years of financial risk protection coverage given by RSBI and other state-funded health insurance schemes. I think I'll stop there.
Will it be viable to the private sector? So what would be the solution? I think we've been talking, but I think for the scheme to succeed, there has to be a meeting point between all the stakeholders. I think one big area which I think there's a huge lack in is the government health machinery. I think crores of money are spent in government hospitals. I think the number of beds that the government hospitals have is much more than the private sector. But in most of the states, I think the outcomes, it's like a factory running at 20% of production, which is not acceptable. And if you analyze this further, I won't go into details. It is because the primary reason is because there is a lack of specialists. And the government has taken steps to try and rectify that. But I think very soon the government should ensure that the hospitals run by the government, and the government is committed to provide healthcare to all. It's not the private healthcare institutions. So I think it's important that all of us focus on government hospitals, make them provide state-of-the-art care. 60 years ago, I was born in a government hospital as a premature infant. And at that time, everybody knew that to get good quality care, you had to go to a government hospital. There is no reason why that cannot happen again. And there has to be a balance, a healthy balance. If you remember, the board committee had said that the proportion should be 70% government and 30%. And it would not be too difficult. In fact, in our state of Karnataka, where a lot of out-of-the-box ideas have been thought of, the health secretary has started taking measures to make sure that with the existing infrastructure, with the staffing, what is the maximum output. We've also started making sure that national board seats are now available in district hospitals. They've introduced College of Physician and Surgeons. So within 2 to 3 years, like in Maharashtra, we should ensure that the government is providing much of the service. So I think that is one thing very important. We have also spoken to the Niti Aayog and said, this is something that you have to focus on, make sure that government hospitals deliver. It shouldn't be too difficult because they've got the rest of the infrastructure, the resources are there. It's like having a bus driver, having a bus without a bus driver. So that is one area. Now, looking at the private sector, how can the private sector help? Again, this was discussions with the health secretary in Karnataka. At the present time in Karnataka, the private hospitals are subsidizing the poor patients. We did a study in Karnataka by the IIM Bangalore and NABH, and it showed there's a huge gap between the actual cost and the reimbursement. But the private hospitals in Karnataka said, yes, it's fine. We will do that as long as that 10-20, it doesn't exceed 20%. And the government of Karnataka has also come up with another suggestion, which I hope will be accepted by the cabinet. It's where above poverty line patients would be part of the scheme, but they allow co-payment. So it balances out.
When you talk about Ayushman Bharat, it doesn't mean only you need to have doctors or nurses, but they're also talking about 150,000 wellness center as a part of it. So who is going to be there? Because today, if you look at primary health centers where you are expected to give the primary care, which is going to be the backbone for any healthcare system, that has measurably failed. So you need to look at how do you generate. So taking clue from Dr. Thomas, Alexander Thomas, today morning we had discussion with the Niti Aayog, the advisor, and he was talking about involving IGNOU or IGNOU kind of institutes to give a 3 months training, then getting them back into the workforce, again retraining. That is the way they have taken a short-term goal, but of course also we are working with the Health Sector Skill Council to get the number up to meet the demand. Because you understand, certainly we are talking about 50 crores population given health insurance coverage or some sorts of coverage. And if they really start knocking the door, then automatically your infrastructure, not only in terms of manpower, in terms of physical infrastructure is going to be shortage. And I must take it again from Dr. Alex. He's talking about quality healthcare, but the amount, the figure, what has been proposed by the Ayushman Bharat, do you think in that price, in a city like Delhi or Mumbai, can you offer really high quality care? The reasons are simple. Ernst & Young has done study where it shows even at the current CGHS reimbursement rate, a CABG surgery in 76 hospitals whose performance have been published publicly, they have incurred close to 0.2% loss. Knee surgeries have made around 4% profit. But if that is the trend and your NHPS is coming at 10 to 15% lower rate than CGHS reimbursement, how are you going to support it? That is going to be one of the things. And coming back to your other cost, you were talking about infrastructure and other cost components. One of the major challenge, again, is going to be inclusion of technology in your system. Many people are talking about you scale up, you get a lot of patients, but think about government institution in one hand where your capacity is more than 100% consumed. You think about private sector where high quality care is rendered, or somebody who is coming forward for Ayushman Bharat, probably they are also in a utilization level of 85 to 90%. So where do you get it? And at that utilization level, when you don't have further scope of increasing your resource utilization, and you look at high-end technology, then you'll find it extremely difficult to fund for this technology, even if you are intended to do so with this kind of reimbursement. Just quoting a meeting of last week. The Siemens Global CEO was in Mumbai, and we had a meeting with him, and he was talking about all the recent technologies and all. And there was a very senior colleague from the healthcare delivery side who was present along with me, and who is a doctor himself, an entrepreneur. He happened to tell, we have to move to 16 slice city from 256 slice city. What is the reason? Because if you are thinking of 256 slice, you can finish 95% of your cases in 16 slice. But if you're investing in 256, the kind of tariff you need to fix, that is not going to be supported by this kind of reimbursement. So you need to think about your prudent decision on technology investment. Think about human resource. There are two components. One is your medical, another one is non-medical. The medical technology, a medical resource means doctors, consultant, the kind of expectations they have, I'll not say it is wrong, but probably we cannot support this kind of reimbursement to the doctor or fees to the doctor, the kind of reimbursement we are going to get from this. And of course, we have to be very lean, and we have to be very thin in terms of organization structure when you think about meeting this kind of expectations.
India's healthcare industry is one of the fastest growing sectors, and in the next 10 years, it is likely to reach $275 billion. With growing consumer needs for high-end diagnostics, improved medical quality and precision, the capital investment in the sector has grown multifold. The sector in India is well diversified, full of opportunities. Medical tourism is growing at 20-25%. Standard Chartered Bank is proud to be partner in this growth with our specialized products to cater to your needs for effective collections and payments. We are focused on helping your business by providing bespoke solutions using our expertise developed over the years and across markets. We have a legacy of 160 years in India.